Hello and welcome to part 2 of my audio medical basics about the viral hepatitis from the case files internal medicine book of my case files series. In the first part we spoke about the clinical approach of viral hepatitis, definitions, considerations, and now we'll move to diagnosis. So please refer to part 1 for part 1, and now we'll continue about viral hepatitis. Titled Diagnosis. Clinical presentation does not reliably establish the viral etiology, so serologic studies are used to establish a diagnosis. Anti-hepatitis A immunoglobulin, anti-hepatitis A immunoglobulin M, abbreviated as IgM, establishes an acute hepatitis A infection. Anti-hepatitis C antibody is present in acute hepatitis C, but the test result may be negative for several weeks. The hepatitis C RNA assay, which becomes positive earlier in the disease course, often aids in the diagnosis. Acute hepatitis B infection is diagnosed by the presence of hepatitis B surface antigen, abbreviated HBsAg, in the clinical context of elevated serum transaminase levels and jaundice. Hepatitis B surface antigen later disappears when the antibody is produced. The antibody is anti-HB, anti-hepatitis B surface is produced. There is often an interval of a few weeks between the disappearance of hemoglobin surface antigen and the appearance of the anti-hemoglobin surface antibody. This period is referred to as the window period. During this interval, the presence of anti-hepatitis B core antigen IgM, abbreviated as anti-HBc IgM, anti-hepatitis B core antigen, is indicative of an acute hepatitis B infection. Hepatitis B pre-core antigen, abbreviated as HBeAg, represents a high level of viral replication. So hepatitis B pre-core antigen represents a high level of viral replication. It is almost always present during acute infection, but it's persistent over 6 weeks of illness is a sign of chronic infection and high infectivity. So it is almost always present during acute infection, but its presence over 6 weeks of illness is a sign of chronic infection and high infectivity. Persistence of hepatitis B surface antigen or hepatitis B pre-core antigen is a marker for chronic hepatitis or a chronic carrier state. Elevated versus normal serum transaminase levels distinguish between these two entities respectively. Prevention. The vaccine for hepatitis A is indicated for individuals planning to travel to endemic areas. Post-exposure prophylaxis with hepatitis A immunoglobulin, along with the first injection of the vaccine, should be given to household and intimate contacts within 2 weeks of exposure. The hepatitis B vaccine is recommended for healthcare workers as well as for universal vaccination of infants in the United States. Hepatitis B immunoglobulin, HBIg, is given after exposure, such as a needle stick injury from an infected patient or to a newborn of infected mothers. The first inoculation of the vaccine usually is given concurrently. There is no immunization and no proven post-exposure prophylaxis for persons exposed to hepatitis C. So there is no immunization and no proven post-exposure prophylaxis for persons exposed to hepatitis C. Interferon treatment may be used in individuals with hepatitis B or C infection, and lamivudine is used to treat patients with chronic hepatitis B. Lamivudine is used to treat patients with chronic hepatitis B. Finally, acetaminophen hepatitis. Acetaminophen-induced hepatocellular injury may result after a single large ingestion, as in a suicide attempt, or by chronic use of over-the-counter acetaminophen containing preparations for treatment of pain or fever. Hepatic toxicity most often occurs after an acute ingestion of 10 grams or more, but lower doses may cause injury in patients with pre-existing liver disease, particularly in those who abuse alcohol. Acetaminophen is metabolized in the liver by the cytochrome P450 enzyme system. Cytochrome P450 enzyme system, which produces a toxic metabolite. This metabolite is detoxified by binding to glutathione. Potential hepatic injury is greater when P450 or P450. It's greater when this P450 activity is augmented by drugs such as ethanol or phenobarbital, or when less glutathione is available, as in alcoholism, malnutrition, or AIDS. Acetaminophen levels are measured between 4 and 24 hours after an acute ingestion and plotted on a nomogram to predict possible hepatotoxicity and determine if treatment is necessary. Sometimes empiric therapy is started even before labs results return. If acetaminophen levels are above the level that predisposes to hepatic injury, treatment is started with gastric decontamination with charcoal and administration of N-acetylcysteine, which provides cysteine to replenish glutathione stores. N-acetylcysteine should be started within the first 10 hours to prevent liver damage and is continued for 7 to 2 hours. Meanwhile, the patient should not receive any medications that are known to be hepatotoxic. So, clinical pearls of this case. The 3 most common causes of acute hepatitis with elevated transaminase levels exceeding 1,000 international units per liter are viral infection, toxic exposure, and ischemic injury. The large majority of adults with acute hepatitis B viral infection recover completely, but 5% to 10% develop chronic hepatitis. Fulminant hepatic failure, characterized by the rapid development of hepatic encephalopathy, coagulopathy, peripheral edema, and ascites, usually is fatal unless a liver transplant is performed. Prevention of hepatitis B viral infection hinges on long-term immunity with a highly effective recombinant vaccine and short-term post-exposure prophylaxis with hepatitis B immunoglobulin, HBIG. The likelihood of toxic acetaminophen injury and the need for treatment can be predicted from a nomogram based on serum level and the time since the last ingestion. Thank you very much for listening for our case from the case files book, Internal Medicine, about the viral hepatitis. And inshallah, we'll see you in the next part with another case of internal medicine from the case files book. Please take care, like, share, subscribe, and leave a comment. And take care of yourself.